Hey folks, it's Reggie, and today we'll talk about health insurance and how to choose the health insurance plan that's best for you. So running my own insurance agency, many people will ask me, Reggie, what are your lowest rates? Or what are your cheapest rates? But what they're really asking is how do I make sure that I'm paying the right price for the type of insurance that I'm getting? So when you are evaluating insurance, in general, insurance companies will determine the cost of your insurance based on the amount of financial risk you are willing to assume. So in other words, the more financial risk you're willing to assume as it relates to your medical expenses, the lower the cost of your insurance will be. And that lower cost comes in the form of the premiums that you pay on your insurance policy. The premiums are actually the monthly payments that you make in order to keep your policy active. So now that we know that the premiums are what the insurance companies use to determine what it's going to take for you to keep your policies in place, let's take a look at some of the factors that actually impact the premium the most. The three factors that have the biggest impact on what those premium costs are going to be are your deductible, your coinsurance, and your out-of-pocket maximum. So those things are the biggest impactors or the biggest factors that determine what your insurance premium costs are going to be on a monthly basis. So here we are. When we look at the deductible, the higher the deductible, the lower your premium will be. Now, the deductible is the out-of-pocket expenses that you have to pay before the insurance plan actually kicks in. So if you choose a $5,000 deductible, for instance, and you incur medical expenses of $4,999, you will pay that entire $4,999 before the insurance company is on the hook to pay a single penny. And that's how that works. So when you're factoring in or trying to determine what insurance plan you should go with, you need to keep those things in mind. The coinsurance, that's what you will be expected to pay once the insurance company does kick in. So if, for instance, you had a $10,000 medical expense and you have an 80%, 20% coinsurance plan, which means that the insurance company is going to pay 80% of the medical expenses and you'll be expected to pay 20% of the medical expenses once the deductible has been met. So in the previous example where we were saying there was a deductible of $5,000, for this example where we've got a $10,000 medical expense, the insurance company is going to pay 80% of $5,000 because the first $5,000 was all yours. Now, when we look at the out-of-pocket maximum for on an annual basis, your out-of-pocket maximum may be $20,000. In this case, in this particular case, that means that once you have actually incurred medical expenses of more than $20,000, your portion that is, the insurance company then begins to pay 100% of the cost. Now, knowing that, that means that your maximum out-of-pocket expenses on an annual basis for the plan that you have chosen will be $20,000. And each year, the clock starts over. So if you incur $20,000 worth of expenses this year, at the beginning of the next year, it starts all over for you. And once again, you'll be on the hook for potentially another $20,000. So those are the things that you need to keep in mind when you're purchasing your insurance. And then there are a whole lot of other offerings that have an impact on the entire profile of products that an insurance carrier actually provides. You know, whether or not you're willing to pay for doctor's visits or how much of the doctor's visits you're willing to pay for. What do you want to pay for your prescription drugs? Do you want annual exams included? Do you want maternity covered? All these things get factored in. What is your age? What kind of health conditions are you dealing with or have you had? So all these things come into play when the insurance company is determining what the costs are going to be for you. So this will do it for this particular video. And in future videos, I will share more information with you on how to actually go about getting quotes, especially from my site, for the various plans that are offered. One thing that you should understand is that when you're dealing with insurance brokers or insurance agents, we all offer the exact same plans. So when you're looking at someone that's telling you, hey, I can give you a better rate, what they're really telling you is they're going to put you on a different plan from the plan that someone else may have given you for a particular quoted rate. So when you're dealing with an insurance broker or insurance agent, what you're really doing is you are choosing who you want to do business with. So hopefully this has been helpful for you. And if you need more information, by all means, give me a call, or you can visit me or visit my website and start looking at the various plans that are available. Thanks. I hope you have a wonderful day and take care. Bye.
Tonight, we report on the healthcare system of Australia. 24% of those surveyed in a recent poll said the Australian system works pretty well. Life expectancy in Australia, 81 and a half years, third highest of the 30 developed nations. There is universal coverage, and the system is funded mostly with public money. Brooke Baldwin reports.
Australia, population 21 million. Their healthcare system is called Medicare. Same name as in the United States, but much different. In Australia, everyone is covered. Medicare pays for an entire visit to a public hospital and reimburses a trip to the family doctor. Most medication is covered under the plan, which does require a copay. The system is funded by income taxes. Most Australians pay 1.5% of their salaries. Those with higher incomes pay an additional 1%, and there are low-income exceptions. But the public option isn't the only option, as Victor Rodwin, who studies healthcare systems around the world, explains.
Australia has a Medigap private health insurance sector similar to the French, which allows coverage of supplementary benefits and some co-payments.
Approximately 43% of Australians opt to buy private insurance as well. According to Ian Butler, an Australian doctor currently practicing in the U.S., a primary reason for buying it is that people can bypass long waiting lines for elective surgeries.
If you are sick, say with a stroke or a heart attack or pneumonia, there's really not much of a problem. But if you, say, wanted a hip replacement and you wanted it done more quickly, more expeditiously, and say by a particular surgeon, then it would be to your advantage to have private insurance.
It also helps cover costs for private hospitals and specialists not entirely covered by the public plan. Australia spends 8.7% of its GDP on health care, compared to 16% in the United States. Total annual spending amounts to $3,137 per person, compared to $7,290 in the U.S. Life expectancy, 81.6 years versus 78 in the United States. On the whole, 24% of Australians surveyed in a recent poll said their system works pretty well, compared to 12% in the U.S. On the life expectancy end, which, by the way, is 2 years higher in Australia than the average, the OECD points to the fact that Australia has received remarkable success in reducing tobacco consumption. In the last 20 years, they have cut the percentage of adults who smoke in half. How about that?
That's terrific, and we haven't done nearly so well.
We haven't. Maybe they're enjoying the Great Barrier Reef and diving instead.
You know, getting rid of those cigarettes and being able to make a tank last a little longer.
Maybe.
Brooke, thank you very much.